Hey guys, good morning. Welcome to another AMA with Dr. Behnam. I'm a board certified dermatologist and founder of one of the co-founders of Happy Ed. Welcome to our first AMA session of the new year. So we're very excited, basically, to be on today. So let me get here. We go. So first of all, a disclaimer before we get started. I want to remind everyone that this information is for educational purposes only and is not meant to provide medical advice or services. Please do not rely on this information to make medical decisions. And remember the risks and benefits of any treatments. You have to talk about them with your doctor before starting any treatments. So, pregnancy disclaimer. Also, let's talk about this stuff. So we have a bunch of questions that we're going to go through, and if you have any other questions, please let us know. You could just type it in. So, what are the options for men who have a pregnant or breastfeeding partner? So, typically, the Happy Head topicals usually contain finasteride and retinoic acid, and we don't want pregnant females to become exposed to them. So, our recommendation is that if your partner is pregnant, you either want to go with like the very simple topical minoxidil over the counter, which has no retin-A or finasteride in it, or easier just to go with the pill. If you take the pill, your partner won't get exposed to the medication. So you could take like the oral minoxidil, oral finasteride, or the super capsule. Just don't have your partner touch or take the pill, of course. Now, what are the options for females who are pregnant breastfeeding? Unfortunately, there are really no good options. You kind of have to wait until after breastfeeding to really address the issues. Now, the good news is here that most females, when they are pregnant, because of the estrogen levels that are just really high, they actually have much better hair. So the hair loss issue becomes less of a worry during pregnancy. Now, after pregnancy, some females who go through the postpartum basically hair loss, which is a form of telogen effluvium, where you could lose hair, a significant amount of hair. Usually, that happens about 3 months after basically childbirth. And again, I mean, unfortunately, if you are breastfeeding, there's really not much you could do. But if you're not breastfeeding, then there are some good options, such as oral minoxidil or oral spironolactone. So those are good options for females that are postpartum, not breastfeeding. Now, what are the best ways to apply the topical? So I'm just going to show, basically, here's our topical formula. So just like the Rogaine over the counter where you want to do 1 ml twice a day, the topical Happy is also 1 ml twice a day. So I'm just going to open one so you could see it. So when you basically press down on the pipette, it is designed to go to zero point 0.5 of an ml. This is how it's designed. So a lot of people would do a zero point 0.5 and put it in the front and rub it in, then apply another zero point 0.5 to the back and rub it in. So that's 1 ml. So there's 2 pumps equals 1 ml, and ideally you want to do it twice a day. Now, a lot of people always ask, can I do this once a day? I mean, people want to do it once a day for a variety of reasons. One, they just don't have time to do it twice a day. Number two, sometimes it causes like basically irritation, which it makes sense. So doing it once a day is fine as well. But we do recommend that if you do want to do it once a day, do 3 pumps. You're actually getting 1.5 ml basically onto your scalp. People also ask like, why is the design of the bottle the way it is? So before we had started, we actually did like a lot of different testing, like a lot of different bottles and sprays. We realized that the spray bottles, many problems with the spray. First of all, the monoxide plugs up the tip. Number two, when you do the spray, like a lot of the material gets stuck on the hair on the top, so you're not really getting it on the scalp. So the pipette is perfect because you put it directly onto the scalp, basically, and you release, and then you apply the rest of the material onto your scalp. So we found that the pipette is usually the best way of applying this product. But if you really like the spray, just get one of the Happy Hip bottles, buy a spray over the counter, a spray bottle over the counter, put it in there, and just spray your head. I mean, very easy. Best way to apply the liposomal formula. So first of all, what is a liposomal happy end? It's a very unique formulation where the finasteride dissolved in a special vehicle known as the liposomal vehicle that prevents the systemic absorption of finasteride into your body, and as a result, it reduces the risk of sexual side effects. Uh, for the liposomal formula, we usually say that 3 pumps equals 1 ml. So we'd like our patients to do 3 pumps, 1, 2, 3, applied all over the scalp. Now, morning or night, you could do it morning or night, whatever you like. You could switch it up. It really does not impact it. You could do it just whenever you wish. Um, Now, what are the potential side effects of spironolactone? So, spironolactone is an FDA-approved blood pressure medication in the U.S. that is used off-label for hair loss in the U.S. In the United States, spironolactone is only used in females, not generally for males, and the reason is because spironolactone could cause man boobs in males, so we don't want that. The way spironolactone works is actually very similar to minoxidil. To finasteride actually. Spironolactone is a testosterone analog, which means it competes with testosterone and it blocks the binding of testosterone. So it's really preventing the effect of testosterone on your body. So it's used in females basically for hair growth. If you kind of compare all the medications for females, oral spironolactone, oral minoxidil, in my personal opinion, I believe that the oral minoxidil is a better medication than oral spironolactone. What are the side effects of oral spironolactone? So again, spironolactone is an FDA-approved drug that used off-label for hair loss in females. Most common side effects includes breast tenderness, irregular periods. You can have like a lot of hormonal changes, like uh, cramps around your periods, having multiple periods in a month, which is none of this are fun. Um, and it could also reduce your blood pressure, but not really that much. And we do not recommend patients getting pregnant on this. And we also recommend patients not to take like a lot of food that high in potassium. So so again, female, some patients do like spironolactone. It is still a very commonly used drug in the U.S. for female pattern hair loss. If for it to really be effective, we want patients to use at least 100 milligrams a day. If you're at a 50, it doesn't really work for hair that great, but it will help you with adult hormonal acne. So if a patient comes and they have adult hormonal acne and also hair loss on top, spironolactone probably would be the best choice because you're going to hit two birds with one stone. Now, how often should I be derma rolling? Every day, 2 or 3 times a week. So we don't have a derma roller here. Okay. So is this derma roller? What is this? I don't know what that is. Okay, so derma roller. So derma roller basically is a roller that's about 540 spikes. So you could really use derma roller either every day or just a couple times a week. A lot of our patients just use it 2, 3 times a week. Uh, the way we recommend it for you guys to use it, you can use it before or after applying the happy head. But I think a lot of people do find it very useful that when apply happy head and the hair is wet, you gently derma roll. I think it just makes more sense and makes it easier. And also you're gonna push in that product into your scalp. Couple of things about derma rolling. First of all, we'd like the Happier derma roller because the 0.25 derma roller is a very robust product. Some people like to use the 1 millimeter or 1.5 millimeter. Those things really hurt. And what I've seen in my personal experience is that sometimes patients get carried away and they use a 1.5 that's very aggressive and they actually cause more scarring. So I highly recommend you guys do not do that. I like the 0.25, do it for a minute, roll up, down, left, right, and do it a couple times a week. If you could do it every night, that's great, but 2 or 3 times a week, that's perfect. Again, don't be rolling it constantly in the same place. Constantly move around, so go left and right, up and down, diagonally. Do not be in the same location. Do not press too hard. Do not make your scalp bleed. Also, somebody just asked, can you do dermal on hair transplant hair? Yes, you could. I mean, obviously, I wouldn't do it within like a week or a month of transplantation, but 6 to 8 weeks, like about 2 months, you should be fine. Just do not be very aggressive with the dermal roll because you could really hurt yourself. Now, does dermal rolling increase the risk of topical side effects as it gets more through the bloodstream? In theory, yes, but not really. I think it definitely will help you doing it. So it shouldn't really increase the side effects that much. But obviously, if let's say to some patients are very sensitive and you start to use Dumarolo and you experience more side effects, then stop or don't do it as often. And also one more thing about Dumarolo, so get an alcohol spray bottle on Amazon, and after you're done, just spray it down. And once a month or once every 6 weeks, you want to switch it out and get a new one. Should I have a different hair care routine in the winter versus the summer months? How do I protect my hair from cold, dry weather? So that's a great question. So we know for sure that in the winter months, patients tend to lose more hair. So and the summer months, patients have much more thicker volume hair. So for example, so on Christmas Day, you're gonna probably have your thinnest hair in the entire year, and on 4th of July, you're probably gonna have your thickest hair because patients tend to lose more hair in the fall. Remember, hair loss is cyclical, and that's nothing to do with what you're doing wrong. It's just it goes in a cycle. So how can you protect your hair? So we highly recommend just using like a good conditioner, because if you think about it, conditioner is like a moisturizer for your hair. And listen, when you do a moisturizer for your body, you're protecting it against from some of the natural stuff that could damage your skin. And the same thing with the hair. When you moisturize it, basically you're just keeping it healthy and you're protecting it. So that's why the scalp moisture, the hair, the happy head conditioner is really good because it really will help to protect your hair. So that's the only thing I would do different basically during the colder months. Now, does medication efficacy decrease over time? It's a very good question, and the answer is yes. Most patients will plateau at some point. This is why my patients have been on oral finasteride for like 10 years. When they come and see me, they're like, Doc, look, I'm losing my hair. And the reason is because they've just plateaued on that formula. Um, Now, does that mean that if you stop it, it's not going to make any difference in your life? Actually, that's wrong. If you stop it, then you're going to have a reverse impact. You're going to lose a lot more hair. So, although you're plateaued, it's still maintaining your hair. So, it's still doing something good. You're just not getting the added benefits of having more hair growth. And this is why, basically, after patients being on the finasteride for so many years, we like to add like maybe or like if oral minoxidil to the regimen, or add the topical happy head, which is topical finasteride with minoxidil, uh, or basically switch the finasteride to dutasteride. So you want to change it up a little bit so your basically body basically causes more hair to grow out. Now, since you have to continue using the medication, how do I make sure that results don't decline? Again, adding other alternatives, other medications to your care regimen, basically make sure that your body doesn't get used to it. Now, how long does it take for it to grow after hair transplant? Usually, actually, hair takes about 9 to 12 months for it to grow after hair transplants. Can you walk me through the hair transplant process? Yes, absolutely. Maybe one of these days we could have Dr. Sean come up and you could talk about it. But so the way the hair transplant process works is that you take the hair from the back, and there are two ways of doing it. You could do what's called the traditional strip method that no one really does anymore, where you do a huge cut on the back of the scalp, take a huge part of the scalp out, and then you basically cut out all the hairs, and then you take those hairs and you transplant it in the front, like give it a good design. What has become very popular is FUE, which is known as full clear unit transplantation. And this is what really has become popular, and this is what we really do, is where you take each hairs out individually. So you're not making that huge cut. So you don't get that big, huge scar on the back of the scalp. You do one hair out individually, and then you transplant it up in the front, basically, of the scalp. And then you give it a good design. The FUE definitely takes a much longer time. And when we started out doing FUEs in 2009, you could probably do only 200 a day, but now, I mean, the technology has gotten better. The machines have gotten a lot better. So just today, actually, Dr. Sean is doing a transplant 3,000 hairs in one day. So you take 3,000 hairs from the back, the beard, sometimes the chest, and basically make those sides in the front, and basically transplant it in. So yeah, so those are exciting stuff. And the field is really changing. I mean, you know, we do work with another company that's currently is doing a process where you just take the hair out, punches it out, and it just goes all the way to the front, transplants it right there in the front. So currently that's being in the works. So what are the customizations this Happy Head offers? So Happy Head offer probably over hundreds of different, about 100 different customized medications. So we have a lot of topical variations. So our standard formula is the finasteride with minoxidil retinoic acid, and that could be customized in many different concentrations. We also have our topical dutasteride, minoxidil, retinoic acid combo, and we also have, our other versions where we have spironolactone in it. We have finasteride and dutasteride combined together. So we have many different versions of the topical, and now we have a lot of different versions of our oral. So we were the first group in the U.S. to actually introduce the combination super capsules. So this was the finasteride minoxidil with vitamin D all combined together, or the dutasteride minoxidil vitamin D all combined together. And now we're actually going to be introducing two new products that I'm going to be talking about on this on our podcast today. So we realized that unfortunately, we knew this as a fact for many years, that finasteride and dutasteride could both have risks of sexual side effects. Um, and so we have always been thinking about how we're going to kind of counteract some of those sexual side effects. So traditionally, we have told patients to kind of titrate up slowly so your body doesn't get a shock. Um, and that kind of worked for like a lot of patients. But then we realized that there's a huge field of medicine where basically it deals with erectile dysfunction. So, for example, like Viagra and Cialis, and there was actually a study that shows that if you use the Cialis tadalafil formula, which is used for erectile dysfunction, and combine it with finasteride, it could actually lower the risk of some of the sexual side effects of finasteride. So our new formula is going to be the finasteride, tadalafil, and vitamin D combined together. So that's finasteride for hair growth, and then you have basically the generic for Cialis, which is the erectile dysfunction medication, and vitamin D all combined into one medication. And what that does is basically that is going to allow not only allow hair growth, but also it's going to reduce the risk of sexual side effects. Now, one of the questions people always ask is that tadalafil, I mean, can you take that every day? Yes. Tadalafil is intended to be used basically on a daily basis. There's also some studies that the Viagra version topically can also basically increase blood flow to the scalp and also cause hair growth. So there's some possibility that tadalafil itself could also cause some hair growth as well. So we're going to have the finasteride combined with the generic for Cialis, and we're going to have the dutasteride combined with the generic for Cialis. What are some of the side effects of tadalafil? So side effect includes headaches, nausea. Those are some of the common side effects. We're going to be launching the product in February. Now, what makes Happy Head different than our competitors is that, first of all, we're the first one to come out with this formulation, and no one else has it. So that's, simple as that. Now, if I stop taking the oral medication and just use the liquid instead, will I lose the results? It's a good question. I don't think anyone really knows the answer to that, and everyone's is different. I have a lot of patients that were on oral finasteride for many years and started using topical Happy Head, and then they stopped the oral finasteride and they're doing better than before. But again, everyone's different, so it's hard to really make a judgment call on that one. Does Happy Head help the hair transplant process? How soon after can I start taking the medication? Pill versus topical. So in our own personal office in Santa Monica, when we do hair transplant, pretty much everyone goes on. I'll tell you what people go on. They go on the Happy Head vitamins. Really, really important. This is really critical because the Happy vitamins basically provides vitamin D, iron, biotin, um, and also usually patients are taking like 3, 4 different vitamins together. So this kind of simplifies the entire process and is really good after hair transplants. We also have patients do the Happy topical about a month to 6 weeks after procedure, and some patients may start on the oral right away. So if you do the transplant, you could start on the oral right away, and we put patients on our super capsule, which is a finasteride minoxidil vitamin D. They start the topical Happy a month later, and they start the multivitamins right away. So does that make sense? So they start the orals, you can start right away. So the multivitamin and the super capsule start right away. The topical about 6 weeks later. Do you support laser caps, and what's the success rate? So look, in my opinion, I think those laser caps work about 50% of patients. I think they sometimes tend to work better in females than males, but again, that's hard to say. Um, so we do like the laser caps, but remember, it's not um, for everyone. And in my opinion, uh, it does. I mean, it will help, especially when you do it in conjunction with everything else. You have to realize that hair loss. There's not just one reason why you're having hair loss. There are multiple different factors of having, that you have hair loss: testosterone, stress, lack of blood flow, tightening of your scalp. So when you throw multiple different things at it, you're probably going to see better results. So which means, if you're going to take the oral medication along with topical, you have more success if you do the laser cap along with the topical, yes, you're probably gonna have more success than doing the laser cap alone by itself. Again, the laser cap is about 50-50. So in my opinion, if you combine it with other things, you're gonna have better synergistic results. Rosemary, fact or myth? Good question. So if you look at in the clinical studies on PubMed, there was a study where they compared rosemary oil to minoxidil 2%, and they realized that the results were similar, which means that rosemary oil did cause some hair growth, as good as minoxidil 2%. Now, how good is minoxidil 2%? If you compare minoxidil 2% compared to minoxidil 5%, the 5% was, I think, 40% better than minoxidil 2%. So minoxidil 2% is okay. Like when a lot of my patients come into the office, they said, Doc, I'm using minoxidil 2%, but I'm not seeing much hair growth. I'm not that surprised. So I usually say, look, either use the 5% or they use them happy at 8%. So again, rosemary oil does help. If you're a patient that you cannot tolerate anything on your scalp, yeah, like anything prescription or minoxidil, yeah, rosemary oil is a good alternative. Is it the best alternative? No, it's not, but it could help. How do I know if it's hair loss or extra shedding? So usually people could lose about 50 to 100 hairs a day. Uh, so let's say that you're losing 150 hairs a day. So obviously you're shedding more than normal. So you're gonna basically eventually end up with some hair loss. Let's say if you're just losing 50 a day, so then yeah, that could be that could be normal for you. So I don't think basically that's gonna contribute to additional hair loss. Guys, these are all great questions. So, a couple things. Happy Head. This is the Happy Head shampoo, and here's the Happy Head conditioner. The shampoo is great because it has argan oil, biotin, keratin, collagen, and saw palmetto. The collagen is really good and keratin is really great. It has no sulfate, no parabens, it's cruelty free. It's a really good shampoo. The conditioner is also really good too. Actually, my conditioner is my favorite, honestly, I tell you. So it just basically revitalizes the scalp, makes your hair smoother, more volume. So I'm a big fan. But I'm the biggest fan of our multivitamin. The multivitamin is actually really, really good because this really combines multiple different vitamins together all in one capsule. You do have to take 4 capsules a day though to achieve basically the recommended dose. If you do this, you do not have to take additional vitamin D. So that's why it's so good. Then we have our topical happy hits, uh, which comes in many different concentrations and formulas. And the way we kind of talked about this before, so the way you use it is you do one pump, you apply on the scalp and you rub it in, and you do another pump, you put it right here and you rub it in. What are your thoughts on oral minoxidil and what is the recommended dosage? So oral minoxidil is a great drug. It's one of those medications that actually has been around for a long time, but it doesn't get like the attention that it really deserves. In my personal office, we write a lot of oral minoxidil. Probably over 50% is oral minoxidil. Um, Oral minoxidil is a blood pressure medication, so which means it increases blood flow to the scalp, and by doing so, it brings nutrients and oxygen to the hair follicles, and it washes away. It washes away basically the DHT. Um, the most important thing is that it does not have any risk of sexual side effects, which is amazing. It actually really works pretty well too. So, and this is why we actually combine the oral minoxidil with finasteride because the oral minoxidil increases blood flow to the scalp. Finasteride inhibits basically the testosterone, and the two combined together basically will do really well. And so what is the recommended dosage? So the recommended dosage, usually, first of all, people are always afraid because, oh my God, is my blood pressure going to drop a lot? Most of the time, it does not. Because first of all, to really achieve those blood pressure changes, you need to be at really high doses, like 5, 7.5, or 10 milligrams a day. What we're doing is that we start at a really low dose, like about a quarter of a tablet or half a tablet, about 1.25 milligrams. So that's a pretty low dose. And sometimes for guys, we may go up to a full tablet of 2.5 milligrams. Now, can you use the topical minoxidil with the oral minoxidil at the same time? Absolutely. And those patients actually see the best results. So if you're on the topical happy and add oral minoxidil, you're gonna do pretty well. What is my daily routine hair care? Oh, that's a very good question. So I do use the shampoos. Actually, I should probably take a video of myself using the shampoos and conditioner. Even my son uses them. I definitely take the multivitamin, and I use the shampoos. In the past, I've been on multiple different things. I've actually, started out using the topical Happy Head, but my wife has been pregnant on and off for the past 5 years, so I kind of had to like kind of let go of that, and I'm pretty much on the oral minoxidil basically on and off. So it all depends how much my kids stress me out. So when they stress me out a lot and I'm shedding a lot, I definitely basically up the medications a lot more. So it really depends on what the kids do. But the oral monoxide is a great drug. And really the combination of oral monoxide and finasteride really helps kind of attack all and address all the different causes, the majority of different causes of hair loss. And because of that, patients end up with better results. That's why we introduce the super capsule, and patients are much happier. And the reason is because instead of taking three different medications, vitamin D, minoxidil, and finasteride, what you're doing is you're just taking one capsule. It streamlines the whole process. It's just easy. I just take the pill every day. It just makes it easier. Now, one of the goals of Happy for this year is really educate our patients about the difference between finasteride and dutasteride. So dutasteride is a drug that's very similar to finasteride, but here are the differences. Finasteride inhibits one enzyme, 5-alpha reductase 2, and inhibits 70% of DHT production. Dutasteride inhibits two enzymes, 5-alpha reductase 1 and 5-alpha reductase 2, which means that when you look at the clinical studies, it actually results in a much better inhibition of DHT. And this clinical studies show it's about 90% as opposed to 70%. In studies, it's also been shown that dutasteride is a much better drug than the finasteride, which means dutasteride works better than finasteride. So it's a better drug. So for hair growth, so dutasteride is a better drug. So if you've been on finasteride and you're not seeing the results that you want, it's probably time to switch to dutasteride. Also, in a study in 2021, they reviewed all the side effects in the literature of finasteride and dutasteride, and they realized that there were more side effects reported with finasteride than dutasteride. In fact, I think it showed that finasteride had 8 times more sexual side effects than dutasteride. I think it was like 8 times more ejaculation side effects. So this means that not only dutasteride is a better drug, but number two, it also has low risk of side effects. So this is why the goal and the mission of 2024 at Happy Ed is that to educate our patients about dutasteride. We believe dutasteride is a much better drug, and if you're on finasteride, that's the old one. 2023 coming to 2024. I just started Happy Head. When will I start to see hair growth? It takes 4 to 6 months to really start seeing hair growth. My recommendation is that to please take photos so you can monitor yourself. Because what happens all the time is that patients come into the office and they're like, Doc, we have not seen any improvements. And when I take that photo and compare it side by side to the original photo from 4 or 6 months ago, there was so much improvement. But since we see ourselves every day in the office, we don't notice the day-to-day changes. So please take good initial photos, and also take monthly photos. And this is why it's also so important, for us, for you guys to actually submit those initial photos, because we have it, then we can always compare it. Okay, guys. So thank you so much for tuning in to Happy Head. Thank you so much for our great team, for making everything possible. Genevieve and Francesca, thank you so much. Happy growing. I like this. Happy growing. Please, if you have a moment, please leave us a review on Trustpilot and also on Facebook. We really do appreciate it. If you have any questions, please reach out to us at help@happyhead.com. And until next time, guys, see you later. Bye. I'm gonna end the stream right now.